Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back to the Hope Natural Health podcast, where I get you healthy the right way. Last week, we talked with a special guest, Dr. Chloe Williams, a dentist here in Scottsdale, Arizona. So if you would like to learn more about why your oral health matters, go back and listen to that episode. But this week, I'm excited to teach you and give you more education about your skin, and specifically skin cancer. So if any of you are followers of me on Instagram primarily, you know that I had a recent diagnosis of melanoma. I didn't think that I would ever have malignant melanoma on my skin, but I also never thought that I would have cancer at age 31 either. So I have now had cancer inside me, and now I have had it outside of me. So I thought I would dedicate this pod to all about skin cancer. And skin cancer is the most common cancer in the United States and worldwide. So this is why we cannot ignore our skin. And I will preface this by saying I got most of these facts and tidbits from skincancer.org. So you can go there for a plethora of information, which is, it's fascinating when you get down to like the stats and the data on this. But here are a couple eye-opening facts. But 1 in 5 Americans will develop skin cancer by the age of 70. I am 43 and had skin cancer. More than 2 people die of skin cancer in the U.S. every hour. Having 5 or more sunburns doubles your risk for melanoma. And I'll talk about the different forms of skin cancer in a second. But when detected early, the 5-year survival rate for melanoma is 99%. And I am in that 99%. It was found early and I'm okay. So let's back up and talk about the different types of skin cancer. So there's 3 different forms of skin cancer. There's actually, I guess maybe 4, which is like precancerous, but we'll talk about the 3 types of actual skin cancer. We have basal cell carcinoma, which is the most common form of skin cancer. We have squamous cell carcinoma, or SCC, which is the second most common form of skin cancer. And then we have malignant melanoma, which is the least common form of skin cancer, but it's the most dangerous because of its likelihood to spread or metastasize. So a fun fact about melanoma is that only 20 to 30% of melanomas are found in existing moles. So every time that I've mentioned I had malignant melanoma, everyone's like, oh, was it a mole? And it actually wasn't a mole. 70 to 80% of melanomas arise on normal-looking skin. So that's where mine was. It was found on my back. And that's a very, very common place for the type of melanoma I had, which is superficial spreading melanoma. And this is the most common form of melanoma. And it can arise as a new lesion or it's an existing mole. But it can grow on the surfaces of the skin before it penetrates more deeply. So this is where it becomes a problem. And for me, it didn't have any what's known as deep margins. So while it can be really found anywhere on the body, it's most likely to appear on the torso in men, the legs in women, and the upper back in both. So bingo, that's where it was in me, in my upper right side of my back, like just above my bra line. So it might appear as a flat or slightly raised and discolored asymmetrical patch with uneven borders. And colors can be tan, brown, black, red, pink, blue, or white. It can also lack pigment or color and appear as a pink or skin tone lesion. So again, I'm getting all of this information from skincancer.org. So what would put you at an increased risk of melanoma? And I'm going to focus mostly on melanoma because 1, that's the one I had, and 2, it's the most dangerous form of skin cancer. But a person's risk for melanoma can actually double if they've had more than 5 sunburns, like I mentioned. But just 1 blistering sunburn in childhood or adolescence more than doubles a person's chance of developing melanoma later in life. Well, I think that's how I developed melanoma in my life because I had so many sunburns as a child. or a young teen, actually, because again, I didn't care about my skin. And so that's why it's so important that you take care of your skin. And if any of my high school friends are listening, they probably remember the time that we had a car wash for cheer camp, and I got so sunburnt that I couldn't even wear my backpack. So maybe that's how I got melanoma. Not sure. But regular daily use of an SPF 15 or higher sunscreen reduces the risk of developing melanoma by 50%. So guess who started wearing sunscreen like on her face just within the last year or two? I mean, me. I didn't know these things. It's like, well, I don't really go out in the sun, but it doesn't matter. Even just walking from your car to the building, you're still getting sun exposure. Or I take my dogs out for a walk every morning. I'm getting sun exposure. Also, melanoma accounts for 6% of new cancer cases in men and 5% of new cancer cases in women. And women age 49 and under, that's me, are more likely to develop melanoma than any other cancer except breast and thyroid cancers. So when I dug into this data, it really made sense. I mean, sometimes you sit there and wonder, why did I get this? Well, one, I got it because I am here now to teach you about it so that you can go get your skin check. And then two, it makes sense, like some of these risk factors that I had and some of the stats like made me more at risk. So it makes it a little bit more, I guess, understandable as to why I had this lesion on my back. And I'm just so grateful that I went in to get it checked. And that's another common question that I've gotten is like, how did you find it? Because it's on my back. I don't know anyone that really like stares at their back a whole lot and looks at lesions. But I had this mole on my cheek that I really wanted to get looked at. And I also knew how important skin checks were. And that's all you have to do is call up your local dermatologist and say, I need a skin check. It's recommended to go at least once a year. If you're out in the sun and have like an outdoors job, I highly recommend going more often. Now that I had this one lesion that was taken out, I now go back every 3 months for the rest of my life for checkups because it was the malignant melanoma. Now, I wanted to share some other information about skin cancer and some more warning signs about it. So this is where like early detection and getting these things checked out makes like a giant difference. Remember, the 5-year survival rate for patients who have melanoma is 99%. And that's where I am. So you want to look for anything new, changing, or unusual on sun-exposed and sun-protected areas of the body. So when you go for your skin check, they're going to check your hair. They're going to check in between your toes. They're going to check everywhere, places like that you don't commonly think that cancer can grow. And if you know me, you know that I'm a huge advocate that cancer doesn't have any rules. It's literally going to just appear wherever it feels like it. And that can be in between your toes. And I have heard that. A college friend or a high school friend of mine said she had some in between her toe. So we also want to look at the ABCDEs of melanoma. So alphabet. We all know the alphabet. So A is for asymmetry. Most melanomas are asymmetrical. And if you're listening to this and want to see my lesion, I would be more than happy to send you a picture. So send me a message and I'll share it with you. If you draw a line through that lesion that you think is suspicious and the two sides don't match, it's likely, something that should be checked out. The reason that the dermatologist wanted to look at mine was because this lesion on my back looked different than any other lesion that I had or any other mole that I had on my skin. So she's like, this one's presenting different than everything else that you have. I want to biopsy it. Sure enough, it was cancer. The B is for border. So melanoma borders are usually uneven and they may be scallop shaped. So another uneven, where common moles are like more smooth and have like even borders. You want to look at the color. So multiple colors are a warning sign, and mine was like tan and brown, and I think it probably had some black. I can't see it, it was on my back, but when I zoomed in on the picture, it looked pretty gnarly. Benign moles are usually one shade of brown. Melanoma might have more, and I think that's definitely apparent on mine. D is for diameter or its darkness. So we want to detect them when they're small, of course, but it's also a warning sign if it's the size of a pencil eraser or larger. So mine was definitely more than that. I have the size of my lesion in my notes here, and it was, the initial size was 0.9 by 0.9 centimeters, so a margin of 1 centimeter was my lesion. Now, a pencil eraser is 6 millimeters, so 1 centimeter is definitely a lot bigger than 1 millimeter. If I do math correctly, I think that is right. And we want, so make sure that you look for the diameter of the lesion. So bigger ones are not necessarily better. And E is for evolving. So you also want to watch it evolve as far as the size, the shape, the color, maybe some more elevation on a spot of your skin, or any new symptom involved with it. Like maybe it starts to itch and now it's bleeding and now you've got a crust over it. Like this could also be a warning sign. So if you notice any signs and symptoms of this, go get your skin checked. Let's see, what else do I want to teach you about this? Well, we have, what do they do about it? So there's different treatments for it. So, or I guess I should say it depends on the stage. So we'll start there with different stages. So like with any cancer, there's going to be stages of malignancy. And again, like the way it was diagnosed was they took a biopsy of it. So they shaved a little bit off of the lesion, sent it to a pathologist, and then they deemed it malignant melanoma and gave it a stage. Mine, like I said, I got very lucky. I'm in that 99%, was stage 1A. So this, because of my history, the dermatologist said, well, I don't think it was a causation of this malignant melanoma. However, my genes, we already know, act naughty, and mutations are, mutate and then they act naughty, similar to like viruses. They mutate and then they act naughty, and we have some bad ones and we have some okay ones. Same thing with cancer in the body. It just mutates and then sometimes it acts naughty, and that's what happened in my case. So different stages. So like I said, stage 1A. So they actually send the samples, at least mine was, to a genetic testing to see its likelihood of reoccurrence. And since mine was so low, that was very, very good. Like, it's a very, very low risk of reoccurrence. Now, if it had been a lot higher, we would have had to talk about other, diagnoses, like had it already spread, or, lymph node biopsies type things. So determining the stage is super, super important. And they actually use a TNM system, which is developed by the American Joint Committee on Cancer, to begin the staging process. So it's based on 3 key factors, the T, N, and M. So T stands for the extent of the original tumor, its thickness or how deep it has grown, and whether it is ulcerated. The N indicates whether or not the cancer has spread to nearby lymph nodes. And then M, as in Mary, represents spread or metastasis to distant lymph nodes. So after these categories are identified, the overall stage number is assigned. So a lower stage means less progression of the disease. So I was in the early melanoma stage of stage 0, which literally means they haven't spread. And then stage 1 means that it usually has penetrated beneath the top layer into the next layer of skin. But the type that they said they diagnosed was invasive, but it hadn't gone to the deep margins. So I got super lucky. If this had been on my back for any longer period of time, it might have gone to the deeper tissues of my skin, which would have put me at probably a stage 2 or higher and maybe more treatment. So what in the heck do they do for melanomas now? Well, like I said, they take the biopsy. Then they either do a slow Mohs or a Mohs procedure. And I was going to read you some information on Mohs surgery because I found it fascinating. I'd never heard of it before. We might have learned it in school, but I don't really remember. But it's usually the most common surgery for even basal cell carcinomas, squamous cell carcinomas. And it was developed, it's technically called a chemosurgery, by Frederick E. Mohs in the late 1930s. But it wasn't really widely known then. And then in the 60s, Perry Robbins, who's another medical doctor, studied the procedure with Dr. Mohs and recognized that it had a great potential for the field of dermatology. And he brought this procedure to NYU, and he developed the first fellowship training program to teach dermatologists the skin cancer surgery. So now it's called the Mohs Surgery, and it has a 99% cure rate for a skin cancer that hasn't been treated before. So what happens is there's slow Mohs and there's Mohs. So I went through slow Mohs, which means they literally, cut out the section of your skin where the cancer is. So they remove the top layer, and then they send the sample to the lab. And they want to make sure that all of the margins, which means the area around the lesion, are clear for any cancer cells. So when they say like clear margins, that's what it means, the area around it. Now, when he cut my lesion, it was a perfect little circle, probably the size of a silver dollar. I don't know. It was probably a little bit bigger than a quarter. And it was left open. So it was nice, perfectly circular shape. And then he cut it into little pie sections with like the clock. So 12, 3, 6, 9. And then each of those pieces was sent to the lab to look under the scope to make sure that they had gotten the clear margins. Because remember, the diameter of the border of my lesion wasn't symmetrical. So we had to cut out a big enough area to make sure that he got all of the margins around that original lesion. And if something came back that it wasn't clear, then he was going to have to take out another layer of the skin. But he scooped it all out in one scooping, and everything was clear on the first try. So when I went in on a Tuesday and had it scooped out or scraped out or cut out or whatever you want to call it, lidocained up with some epinephrine. That was probably the worst part. And then they bandaged me up. I had this giant hole in my back. Open for 2 days until I got the clear that my margins were clear, and then I could go back for the stitching. And he stitched me up. So that's pretty much the procedure of the slow Mohs, like they drag it out a little bit. Now the Mohs procedure is, say you have something on your skin, on your face, that you obviously don't want that giant hole open. So they'll take out the section, they'll send it to the lab right then, and you wait in the lobby or in the room until they get the clear that they got all the margins, and then they'll, address the wound at that time. Or say it's more of a higher risk, a stage 3 or 2 or 4 skin cancer that we need to know now. Do they get everything, et cetera? Do they have to do the biopsy of lymph nodes around the area? Then that's like the Mohs procedure, where it's done in the office and you're literally there all day waiting to know. So I'm super grateful that I was able to go in, get it cut out, go home, come back, and really just had like this wound that was open per se, even though it was covered, the water-resistant bandage, and now I have stitches. So the moral of the story is I'm fine. I'm glad that I noticed it. I'm very relieved that it's normal. Now the cancer is gone. It could have been a lot worse. Literally, I am so blessed with everything that I've gone through up until, till now, because everything could have just been so much worse. And again, I tackled this skin cancer diagnosis with like, oh, okay, well, it's just going to go away and everything's going to be fine. And that was the outcome. And now I'm getting checked up every 3 months for the rest of my life. And honestly, it sounds like that would be a lot of checkups, which it is, but I'm okay with that because I live in Arizona. If you don't know that, I see the sun. I'm not out in the sun. I'm fair-skinned. I've already had malignant melanoma once. I had cancer before that. I don't want it again, even though it wasn't, the most awful of procedures. But again, it's not something I want to go through. So if you have never, ever, ever had your skin checked by a professional, even like looking at your own skin, like notice if there's any weird looking things like I mentioned, go to a dermatologist, call them up and say, hey, I need a skin check, and get in there and get it done. I was in and out in an hour, even with the biopsy on the day that I went in. She biopsied that day in the office. So if you need a good recommendation for a dermatologist here in Arizona, I went to Affiliated Dermatology in Gilbert on Higley and Ray. Highly recommend. Dr. Mullins is wonderful there. NP Kelsey Maddens was my NP, and I was highly impressed with them. We recommended a lot of patients there in school, so that's why I went there myself. And it was right down the street from my office. And they also have other locations in Arizona too. So Affiliated Dermatology is where I went. I just wanted to shout them out because I'm very appreciative for the care I've received. And this is my little PSA for you today. Go get your skin checked. Do not ignore your skin. We'll see you again next week.